Hey, welcome to the Healthful Woman Podcast, the fastest growing podcast in women's health. Today's Monday, September 23rd, 2024. I'm joined today by Shoshana, who's going to tell her birth story from last year. This was Shoshana's second pregnancy, and it was complicated by bleeding and then fetal hydrops, which is a rare and complicated fetal condition in pregnancy. Shoshana has a great perspective on this complicated pregnancy, and there's a lot to take away from her amazing story. A few reminders. The Unexpected, which is the book I wrote with Emily Oster, is available wherever you buy books. Second, please continue to email us any questions you might have for our mailbag podcasts. I just recorded one. I'm about to record a couple others, so we are definitely getting to those questions. To send them in, you can email us directly, hw@healthfulwoman.com, or go to our website and click on the link that says send us your questions. Please remember these questions are for mailbag podcasts, not for your own personal medical advice that you need to answer quickly. Usually from sending in a question to it dropping on the podcast is many months. So you probably won't get the information you need quickly. If you have questions like that, please ask your doctor. You can also send it in for the mailbag so everyone else can learn from it. But for you personally, ask your doctor. All right. Thanks for listening. See y'all next week. Welcome to today's episode of Healthful Woman, a podcast designed to explore topics in women's health at all stages of life. I'm your host, Dr. Nathan Fox, an OBGYN and maternal fetal medicine specialist practicing in New York City. At Healthful Woman, I speak with leaders in the field to help you learn more about women's health, pregnancy, and wellness. All right, Shoshana, welcome to the podcast. So happy to speak to you. How are you doing today?
I'm good, thank God. Thank you for having me.
It is my pleasure. Thank you for volunteering. I always ask my guests, how did you find us? How'd you find the podcast, for example?
So I found you, I listened to another podcast, the Happy Birthday podcast, by Connie Fingerer, and she interviewed you. This is a while back. This is during my first pregnancy, I think. She interviewed you. And then after she interviewed you, I looked up your podcast because I was fascinated by all things pregnancy and birth related. And I wanted more information and more stuff. So that's how I found your podcast. And I don't think I listened so consistently during my first pregnancy. It's really during my second pregnancy that I really became I think I listened to the high risk birth stories. And then when you merged, I think I more listened to the high risk birth stories. And when you merged, I started listening to the regular podcast.
Got it. And you came over with the birth stories, folks. All right. Awesome. And what compelled you to volunteer your own birth story?
I feel like it was a really crazy experience. And I think after my first pregnancy, which was, thank God, uneventful, healthy baby, I didn't realize, even though I listened to these high risk birth stories, I didn't realize that I could end up inpatient in the hospital for 5 weeks waiting for this baby to be born. I didn't realize that. And I feel like it's important to, share that message and let other people hear what could go, wrong or what could happen. Not so much to scare people, but just to be aware of, what the realities can be, that pregnancy isn't so simple and straightforward always. And, and what you have to appreciate when it does go well and is straightforward.
Yeah, it's always a mixed bag. And, because I obviously do this podcast, and it's sort of on the one hand, you don't want everyone to be like, oh my God, and just scare everyone, because that's not the goal. But on the other hand, I think it's also important, not just for people who are or are going to be pregnant, but also the people around them, right? To understand even though, let's say, the people in my life had uneventful pregnancies, thank God, there's a lot of people who don't, and just have an appreciation for that and what they go through. And, and like you said, A, to have compassion and empathy for them, but B, to have a lot of gratitude and appreciation if you're lucky enough to have an uneventful pregnancy, which is obviously terrific.
For sure. And I think there's also an element of some of these things when they were thrown at me were what does that even mean? At the beginning of my pregnancy, it happens to be, I didn't even realize I was pregnant and I was bleeding. I thought it was my period, but then it was weird because it was just spotting. But I was confused. So I reached out to the doctor's office and they're like, we need you to come in. And then they're like, oh, did you do a pregnancy test? I'm like, no. So then they did. And then they made me do repeat blood work. And that's how I even found out I was pregnant. But then when I went for my first trimester screening and they started talking about this elevated nuchal, I don't even think, and I had another baby, I don't even think I knew what an elevated nuchal meant. It was something like that. And then I actually I listened to your podcast at that point. I looked it up. Because I don't even think I knew what they were looking for on these screening tests because nothing came back. So no one even explains it to you. They just do the test. And if something comes back, then they tell you. Yeah. And I think that was another reason why I wanted to, just to be aware of some of these terms and things that I learned about. I only learned about them as they were thrown at me. That's why I love your podcast, because if you just listen on a regular basis, you learn about things that if they get thrown at you, you're like, oh, I've heard of that before.
Well, thank you for the plug. I appreciate it. All right, cool. So take us back. I guess let's go to your first pregnancy. You delivered in 2022. So I guess when you first got pregnant, it was 2021. So, who is Shoshana? Like, where are you living? What are you doing? What's the story going into pregnancy, number one?
Yes. So my husband and I got married in February 2021. We were living in Washington Heights. And then I was a teacher, and my husband was studying in yeshiva, and his plan was to start law school in the fall. So in August, we moved to Queens because he was starting in Hofstra Law School, and it was closer to where I was working at the time. And we moved to Queens, and we got pregnant shortly after that. Like we were ready to start a family, and thank God we got pregnant pretty quickly. And that's where we were at. And I was teaching throughout. My husband was in school, and it was fairly uneventful. I went for my screening tests. As I said, I didn't even know that there was anything. Everything, thank God, was great. It was COVID, and I dragged my husband to most of my appointments, but it was COVID. And I remember the anatomy scan was like January 2022, and there was like a big uptick around then. And I remember it was December. It was December or January, and it was a big uptick at that time. And they didn't let my husband in. And so he sat, and those appointments take a really long time. So he was stuck in the car for like an hour waiting for me. And after that, he refused to come to appointments. And he was like, I'm not sitting in the car anymore.
This is not fun for me. Yeah.
until towards the end, when like my practice there is, a team of doctors. And I kind of my first pregnancy actually just bounced around from one doctor to the next. And I just wanted to make sure I met everyone who does delivery. So towards the end, I made him come back to the appointments so that he had met most of the doctors with me in case for whoever would be on call when I delivered. And it was actually great because I think we saw the doctor who delivered Abigail like 2 weeks before she was born. And like we had asked her, like, I wanted to go to the YU graduation. So my brother was graduating, and a bunch of my siblings-in-law were graduating, and I wanted to go to the graduation. But like COVID was still somewhat concerned, especially because I knew they test in the hospital. So I asked the doctor, and she's like, well, you can use me as an excuse either way. If you don't want to go, tell them your doctor said COVID and you're having a baby and you don't want to get exposed. And if you want to go, tell them that your doctor said you could go.
I like that. I say all the time, like, what answer are you looking for here? Yeah.
She's like, call me either way. And then like in the delivery room, she's like to me, so she said, did you go to the graduation? I was like, well, I was having contractions. I didn't go to the actual graduation, but we went out for dinner with everyone.
All right. That's nice. And the delivery went smoothly, right?
No, thank God it was smoothly. I mean, it was a long, like I started having contractions early Wednesday morning, and she wasn't born until Friday afternoon. So it was a long, Wednesday afternoon, I had an appointment with the doctor. And then Wednesday night, I thought my water broke. So we went to the hospital, and they sent us home because my water hadn't broken. And then Thursday night, like the contractions like finally started picking up, and I told my husband, like, go take a shower because we're going to be in the hospital for Shabbos. So go take a shower and shave, and then we're going to go to and then I'm calling the doctor and I'm getting us sent to the hospital. Like, I'm like, I can't do this anymore. I need an epidural. And that's what we did. We went to the hospital, and at this point I was dilated enough that they were willing to admit me and give me the epidural that I wanted. And then the next morning, I think I got the epidural at some point, like 3 a.m. The next morning when the doctor came in, they augmented my labor with Pitocin. And then the doctor broke my water at some point, like around noon, and she was born by like 3.
Wow, that's great. That's pretty quick.
Yeah. Yeah. And like, my husband and I remember simply that I was pushing, and the doctor's like, you're doing great. You're doing great. And we're like, we thought she was just being a cheerleader, like, whatever. And then she's like, it's a girl. And we're like, what? We're like, we just thought she was like being a cheerleader because that's what doctors do. That's amazing. How fast the pushing was with her. And I actually, with my second one, when like I was pushing and like it's taking a long time, my OB who was doing the delivery, she's like, how long did you push with? I'm like, maybe half an hour, like.
Wow. All right. So that's great. So great experience, relatively uncomplicated. So tell us about, tell us about pregnancy number 2. This is the pregnancy in question. The one we're talking about.
Right. So as I said, I didn't even realize I was pregnant. I was still breastfeeding at the time. And so everything, the bleeding was weird. And, and then I went to the doctor, and they're like, no, this bleeding is actually telling us that you're pregnant, but we need to, track the HCG levels to make sure that this pregnancy is actually implanting and this isn't, leading towards miscarriage.
Right.
And so then I found that I was pregnant. And Yeah, Abigail wasn't even a year old yet, but we were excited, to have another baby to keep growing our family. And yeah, so then we just kind of went on. And then I scheduled my first trimester screening, and my husband didn't come with me because first pregnancy I dragged into everything. But now there's Abigail. So it's like, if there's an appointment, who's watching Abigail? And Abigail's daycare arrangement was that she was in daycare where I work, which means that if I'm not at work,
someone has to
she's
watch
not
her.
in.
Yeah.
Somebody has to watch her. So I went to the appointment and I didn't think anything of it because nothing had happened in my first pregnancy. So I didn't think anything of it. It was fine to be alone. And then the doctor comes in after the screening to tell me that we have an elevated nuchal translucency. And at that point, I didn't even know what that meant.
Mm-hmm.
Maybe you want to share what they're looking for. So our nuchal was 3.4. The threshold that which they get concerned is if it's higher than 3. Does you want to explain what they're looking for? Or you want me to?
Yeah, no. That works. I mean, when you went into the ultrasound, you may not have understood like the numbers in this, but did you know conceptually that they're looking for things to screen for genetic abnormalities like Down syndrome? Was that like even on your radar?
I don't even think so.
Got it. And did they do that blood test, the NIPT, like the one that can tell you if it's a boy or girl?
So we, with Abigail, they did that when I went for the first trimester screening, because the way it works is my OB's office doesn't do ultrasound in-house. So they send us to the Center for High-Risk Pregnancy associated with the hospital. So that's where we did the ultrasound. So with Abigail, I remember that they did the blood test at the time, but I think they started doing those tests in-house by the office, because they told me just to go for the screening, and she's like, I'm almost scheduled to do the blood work next time you come in at like 16 weeks. She's like, we'll do the blood work then, because she thought like it was probably a low-risk pregnancy, and like, it doesn't matter if we do it now or then. And we didn't really want to know what we were having anyway. So it didn't make a difference to us when we did that blood work.
And so meaning when you went in for the ultrasound where they saw the nuchal was elevated, you did not yet have any blood test done?
No. So then at that point, we actually moved up when we did the blood test. After they shared with me that the nuchal is, they're looking for genetic abnormalities, and a higher nuchal means that likely there's genetic abnormalities. Then at that point, when I called my doctor to see, number one, how panicked should I be? And number two, like, what else do you want? She's like, maybe, I was like, should we be moving up when we do this blood work? And she's like, yeah, like coming next week, and let's do the blood work now, just because that way we'll know how stressed do we or do we not have to be.
Yeah. I mean, the way I would have explained it at the time, if you're walking in, you're young, you're healthy, and the nuchal's 3.4, what I would have said is, we're looking on ultrasound for certain features that can sort of indicate an increased or a decreased risk of a genetic abnormality. So meaning if everything is normal, so to speak, it does not mean your baby does not have a genetic abnormality. It just means the chances are very, very, very low. And for most people, if that's the case, they're basically done. They're not going to do anything else, or they've done the blood test, and between those two, they're pretty much good to go. Whereas if it's quote unquote abnormal, it means your risk is higher. And how high it is depends on exactly how abnormal it is, right? Is it 3.4 millimeters or 4.4 millimeters or 5.4 millimeters? And also some other things like baseline, are you younger or older? Are there other things we see on ultrasound? And so what I would have told you is at 3.4, the majority of these babies are perfectly fine and do not have a genetic abnormality, but your risk is higher than you'd like it to be. And so you have a few options. You could either do nothing and say, the odds are in our favor. I'd rather not find out till after birth and get worried, and fine. Okay. Another option is to do that blood test, which is, assuming it's normal, it lowers your risk even further, not to zero, but even further. Or you can be aggressive and do an invasive test like a CVS or an amnio to find out 100%. But I would have stressed that, again, most people in your shoes have normal babies with that number.
That's what my OB basically said. So that's what we did. We did the blood work earlier, and everything came back that it was low risk.
Right.
And at that point, genetics from the hospital wanted us to maybe pursue an amnio, but we weren't interested. We said, this is enough. Like, based on what my doctor was saying, we were willing to say, okay.
Yeah. And that's, it's always something we bring up because, there are, with the blood test being normal, that's really, really good for the things the blood test looks for, things like Down syndrome, trisomy 18 and 13. But there are other genetic abnormalities in theory that could be going on when you see the increased nuchal. And so from the genetic side, to be most thorough, you would do a CVS or an amniocentesis. But again, it's an option. It's not like a requirement. Some people don't want to be that thorough because they don't want a needle stuck in their belly because it hurts or because there's risk associated with it. Not much, but a little bit. And because they may say, I ultimately I don't need this information before birth, and we'll just figure it out after birth. And that's totally reasonable. So some people choose to do the invasive test, the amnio or CVS, and others don't, like you did. And that's fine either way.
We opted not to.
Yeah, which is fair.
Yeah, no, and then we continued. Now they're treating it obviously as more of a high-risk pregnancy. So we did an early anatomy scan at 16 weeks. We did the anatomy scan at 20 weeks. We did a fetal echo at 22 weeks.
All makes sense. Yeah, just to make sure the baby looks good.
Yeah.
And the baby looked good?
Yeah, no, thank God the baby looked good. At the anatomy scan, though, we had a different situation where doctor takes a look and says, it looks like you have a placenta previa, which means that my placenta was hanging over my cervix, which would mean that baby cannot be pushed out vaginally because the placenta would get in the way.
If it never moved.
It would mean that I would, if it doesn't move, I would need to have a C-section. And the doctor told me, she's like, I have people psyched out at 36 weeks that they're having this C-section, and they come in and tomorrow, and they come in and their placenta moves. And I'm like, okay, now you're just going to have to wait it out. You know?
Yeah.
So that's what they prepared us. That's what And I remember when I talked to my OB, because remember we had this nuchal, and I'm like, okay, so is this connected? Is this not connected? And my OB said, she's like, no, the nuchal was a baby thing. We've ruled out based on the knowledge that we have that we're hopefully not too concerned by that. This is a pregnancy thing. This is more of a you thing that's not going to impact the baby.
Right. Correct.
One of the things they told me, and also I think I listened to that point to your podcast about placenta previa.
Cool.
They told me at that point that placenta previa puts me at a higher risk for unexplained bleeding.
Yes. If
I start bleeding, go to the hospital.
Yes.
That was what they told me.
Yes.
So 25 weeks, it's Friday afternoon, and we're Orthodox Jews, and we observe Shabbos. So Shabbos comes, it happens to be during the summer, so it's like, it comes like late, like 7, 8 o'clock.
Yeah.
But it's 4:30 Friday afternoon, and I started bleeding. So now it's like, there's two things. Number one is we call the doctor, we need to go to the hospital. But number two is we need to figure out what we're doing with Abigail. And it's not just who's watching Abigail right now while we go to the hospital, because we might get sent home, in a few hours. It's who's going to watch Abigail for Shabbos, because we're not going to be there.
Right.
So I called my mother. My mother's like, okay, I'm getting in the car to come get her. She called her friends who lived around the corner to come sit with Abigail so that we could go to the hospital right away.
Right.
And then she came and she took Abigail.
Good plan.
For Shabbos.
Good job. Good mom.
Yeah.
Good job.
Yeah, no, thank God. And thank God we lived close enough that was an option,
Yeah.
And she was able to get her before Shabbos. And so we went to the hospital. And we thought, like, we're going to go to the hospital. They're going to send us home. I think my husband even said the bag of stuff that he packed for us for Shabbos got sent to my mother's house. Didn't come with us to the hospital. In the end, we were in the hospital over Shabbos. Because I called ahead, my doctor was one of the OBs from my practice was waiting for me in triage. She did the vaginal exam to check what was going on. My OB did it, not just one of the PAs in triage. One of my OBs did the exam, and they said it looked like it was just a blood clot and that everything would be fine. But at this point, they go into, this is what we have to do in case this is a early delivery. So they gave me the betamethasone.
Yeah, the steroids.
For the steroids for the baby's lungs, and magnesium for the baby's
brain.
Neural brain. Yeah. Yeah, that was fun.
That's an unpleasant experience.
Yeah.
Yeah, I'm not the steroids. The magnesium's unpleasant.
The magnesium's unpleasant. Yeah. No, later when I was in the hospital, one of my nurses, she's like, I had magnesium on my pregnancy. That's awful. I was like, it's like nice to have somebody who had shared my experience.
Yeah, one of my early podcast guests referred to it as flu in a bag. I was like, that's about right.
Yeah.
It's like that's about right. So you're there, but I guess you weren't bleeding too heavy. They only kept you for a day or two.
Yeah, they only kept me. Basically, the betamethasone has to be given 24 hours apart.
So for 24 plus hours.
But literally after the 24 hours, then they started working on my discharge papers.
Okay, so that was a scare, but you went home.
Yeah. And, they're like, okay, when are you going to follow up? I was like, it happens to be that my next OB visit is on Tuesday. So they were good with that. And we went home, and my husband was actually concerned because this was in the end of August, and like the Jewish holidays were coming up, and his parents live in New Jersey, and he was like, can we go to New Jersey for the holidays? He asked my OB, he's like, or should we be concerned this is going to happen again and we're going to end up back in the hospital? Like, he was a little bit nervous, and my OB said, I don't think you need to be worried that this is for sure going to happen again. Sometimes it does, sometimes it doesn't. But she's like, so just be aware of where your nearest hospital is, that
just in
if
case.
You needed to go, just in case. And thank God we made it through the holidays. About a week after the holidays, 31 weeks, I started bleeding again. It was Sunday night. And once again, we called my mom. And we thought at this point, because we had the 25-week thing, we're like, okay, great. we'll go to the hospital, they'll check it out, and they'll send us home.
Right.
But I think that's what they thought. I mean, they did do the beta at magnesium again just to be safe. But and I called my mom to, come get Abigail. Abigail was already sleeping, so a neighbor came and sat with her while we went to the hospital, and then my mom came and got her, and and we went to the hospital. So what we thought we would be staying there, not for long. They did the beta triage. They moved me back to the PACU room just until they figure out what's going on to see if they need to admit me, what's gonna for longer, what's gonna go on. And then the next morning they did an ultrasound to check on the placenta, how's my placenta doing, and also to check on the baby. And they made a discovery with the baby that. This is how we knew they made a discovery, when in comes a doctor who I had never seen, and all the residents had fellows following him.
That's always great.
and we're in one of those rooms where the room is basically just 2 curtains to the hallway. So they all pile in, and there's nowhere for anyone to go. And we're like, okay, what happened?
So what did they see?
So what did they see? They saw that surrounding the baby's heart, lungs, and not heart, thank God, not her heart, but surrounding her lungs and abdomen, there was fluid.
They call it hydrops?
Yes, they did call it hydrops.
Wow.
They said this is a very rare and dangerous situation. It can be. And because of the placenta previa, I was having more ultrasounds because they were tracking my placenta. So they knew that about a month before, none of that had been there.
Right.
Because they had the images from that ultrasound, and they're like, so this hydrops is scary, and it's clearly fast accumulating. If a month ago it wasn't there, and then suddenly this is what we're seeing. And so they said the plan needs to be for an emergency C-section. They would like to wait the 24 hours to have the second beta. And they had the NICU team come talk to us what the chance of a 31-weeker, and then in terms of hydrops, what that looks like. And I think it still hadn't even hit us. How does a myo be? This pregnancy I was actually seeing one specific OB for my practice. She was following me, and then I just saw whoever was on call each time I ended up in the hospital. But she happened to have been on call that day. And she came to talk to us later that night. And she's like, she really wanted to be the one to do my delivery and be there for me. And she's like, she asked the MFM if we're waiting until, after, I have the next dose. She's like, can I do the C-section, tomorrow, early tomorrow, I'll stay late to do it. And he's like, no, you're not doing this type of C-section at, after, a full day shift and, at 1 a.m. I'm not letting you do that. He's like, it's going to have to at least wait till tomorrow. So then they obviously, the next day, they decide that I'm obviously MPO because they think they're doing the C-section next day, but they come to do the ultrasound. And things haven't gotten worse. Because remember, when I first came in, they thought that it was fast accumulating. So they figured if it's really fast accumulating, by tomorrow it might have even gotten worse.
Right.
And it looks pretty much stable.
And did they have an I assume they didn't, because it's very hard to figure this out. Did they have a guess of why this was going on for the baby? Because this is one of the more complex conditions to figure out what the cause is.
They did not. They did some blood work on me at that point.
Right.
We had not done an amnio, but they did not know what had caused it. They definitely knew it wasn't an RH factor, and they didn't think it was viral. So they were kind of at a loss as to what caused this. So they're assuming at this point there must be something genetic. And actually, one of the things they discuss is instead of taking the baby out, that maybe we're going to try to do a
shunt.
Thoracentesis, where they would try to drain the they would try to drain it in utero because that might be better, because then at least the baby can stay in utero at this point.
Did you have high amniotic fluid at the same time?
Oh yes, I did.
Yeah, the polyhydramnios. Yeah, that makes sense.
Yeah.
Okay.
Yeah.
Did they think it was connected to the thickened nuchal you had early in pregnancy?
No, they didn't. I wondered if it might have been. They did not think so, because ultimately we did carrier screening of both me and my husband, and we did thorough genetic testing on me and on the baby, whatever they could do on the baby, and all of it came back negative for anything that could have caused this. So they don't think it was related to the nuchal.
For the record, I don't know how this story ends in terms of this. I don't have any inside information. It's possible those two are related, but we'll see. All right. Interesting.
Right. So they're thinking that they're going to, so that's the next day they decide that maybe instead of doing the C-section right now, let's try to do the thoracentesis, because if we do that, then we can get genetic information and we can see what it is that's causing it, which will help us be able to treat the hydrops better. And so that was their next step thought of what might make sense, and let's keep you pregnant a little longer.
Did they end up doing it or no?
Wait, so they were prepared to do it. Doctor came in with the MFM came in with his,
long needle.
He came in with the needle. He was all ready to go. And they take the ultrasound to check the baby. And when they had done the ultrasound earlier that morning, baby had been in the position that he could have done it. Baby moved. So he's like, okay, I'll come back in an hour. He came back an hour later, and baby had still not moved. And so they were like, okay, I guess we're not doing it today. I guess we'll try again tomorrow. Meanwhile, the next morning, my OB calls me. They had a big conference, about all the, high-risk patients on the floor. And it was decided that the thoracentesis poses more risk than benefit at this point, and they don't think that that is the best procedure to do for my baby.
Okay.
So, my mom said the whole time, because I was upset, because I was like, if this is what they were recommending, then this is what we need to do. Let's do it.
Right.
So I was upset that the baby didn't cooperate. My mom kept saying, she was praying the whole time. And she's like, I'm telling you that God didn't want it to happen. And that's why it didn't happen. I'm like, okay.
Yeah. I mean, ultimately, so you were originally in the hospital for the placenta previa, but now you got this fetal issue. What was it that kept you in the hospital for 5 weeks? Was it the baby or the placenta?
It was the baby. My placenta ended up moving. I ended up having an induction and a vaginal delivery.
Did the Hydrops resolve before you delivered, or the baby was born with it?
The baby was born with it, but when she was born, it was not as bad as they thought it was going to be. It turns out it wasn't around her abdomen; it was around her kidney was hydronephrosis, and that could be treated by antibiotic. So and the lungs was nowhere near as bad as they thought, because they thought they might have to do they might have to drain it right after she was born.
Right.
They ended up being able to let the fluid reabsorb.
Right, and ultimately,
did they procedures on her?
Did they figure out what it was ultimately?
No, they still have no idea. They still want us to come for metabolic testing after she turns 1.
It's interesting.
Maybe that can explain it.
It could. I mean, sometimes, when we see those in the middle of pregnancy, there's a lot of causes for hydrops. None of them are great, but sometimes babies just have sort of, for whatever reason, their what's called lymphatic drainage is not so good. Lymphatic drainage is sort of what our bodies use to sort of move fluid that isn't like blood from place to place, sort of, if that's a way to explain it. So it's not like your arteries or veins. It's like this third piping system that people don't know exists in their body. People know it if it gets blocked, like if someone gets like a really horrible swollen leg sometimes from that. Or, when someone says like your lymph nodes are enlarged, you get like those bumps under your neck or in your armpits, that's sort of in that system. But some fetuses just have an abnormal system. And sometimes we see things that are dilated in the fetus, like the back of the neck. Sometimes they get hydrops, and sometimes it ends up being nothing. And they just sort of, as they get older, it sort of develops and they outgrow it. That's probably the best case scenario, I would say. Yeah. If it's just something weird and anatomic that was, not functioning great as a fetus, but is fine now as the baby's bigger and that system is bigger.
That's what it seems to be.
Yeah, that's the one thing that I could think that would connect the thick nuchal and the hydrops that's not a genetic condition. And again, you would usually know if the baby had a genetic condition after birth, like typically, they test. It's usually not something mysterious. So,
they did a full genome on her when she was in the NICU.
So if it's not genetic, I mean, again, I don't know for sure, but that sounds like that's a plausible thing. I mean, people don't come to this podcast for diagnoses, but we're talking, it's plausible, and that would be probably the best of the scenarios, because it's really just something that was temporary and probably is going to be fine forever. So that's cool. So wait, so the placenta did resolve. You got induced, you delivered vaginally. That's great that they let you do that. That's cool.
Yeah. No, thank God. That was
how did the birth go? Okay.
So the birth was a crazy day, long. So at that point, after they decided not to do thoracentesis, the goal was to get me to 36 weeks. And they kept me at every other day. They monitored the baby just to make sure the hydrops didn't get worse, because if at any point it did, they would have gone back to their emergency C-section. Right. So they induced me. Right. So I guess the beginning was one of my OBs recommended, because, I got a visit from one of the OBs for my practice every day. So I had lots of advice. So when we were talking about the induction, one of them said, she's like, don't get the epidural until you're feeling the contraction, just because that you'll know that the epidural is working. So they started me on Cytotec overnight, and then in the morning before they started the Pitocin, I got my epidural. That was awful. It was an awful placing of the epidural. I don't know. If I hadn't known that there was a very strong chance this was going to C-section, I don't know if I would have gone through with that epidural.
Oh, you mean just having the placement? It was more painful. I didn't ask, did you have an epidural with your first?
I did have an epidural with my first,
but it just was less painful.
it could be it was, I just don't remember. Like maybe my contractions were more extreme and I just wanted it so badly that like, whereas this was like, just a different,
it could be a different experience each time. I mean, the needle's going into a very tight space and sometimes it goes in smoothly and sometimes it's more challenging. I don't know. People definitely have different experiences.
Also, like, I flinch a lot. Like, I'm very ticklish, and like, I think that like the anesthesiologist had no patience for me with that, and like the one with my previous baby just dealt with it, like
Got it. All right,
I think that was part of it, also,
All right, and you said you pushed longer this time.
But even then it was crazy because I had polyhydramnios. The doctor wanted. She wanted to break my water, and that. So even before that, I thought my water broke. It turns out I was bleeding again because I bled multiple times even during my hospital stay. Like I bled multiple times. Like
even though the placenta had moved.
And so I started bleeding. So I thought, okay, great. This is the end of my induction. Like we're gonna go to C-section. My OB had them do some blood work, and she said, okay, we keep going. She broke my water some point in the middle of the day. And one of the other OBs in the practice actually happened to have been there that day doing like other gynecologic surgery in the hospital, and she helped her with breaking my water. She like helped me down,
Yeah, just to make sure that everything, because when there's a lot of water, sometimes you worry when you break the water that maybe like the cord is going to come out or something, and so you have to be you're a little more cautious. We're always cautious, but just sort of more things can happen, so you sometimes want more people around just in case.
Right, and then like at like 3-ish, they like increased the. I was 5 centimeters and they increased the Pitocin. At some point after that did not go so well for me. And I got like a cough and like, it was like, they had to put like an oxygen mask and they had to actually stop the contractions just to give me like some time to recover from that before they restarted the Pitocin.
Okay.
And then like around 4:30, I was 8 centimeters dilated. And the plan all along had been that even though I was having a vaginal delivery, I was going to deliver in the OR because
the NICU team.
The NICU team has their setup right off of the OR.
Right. Just in case they had to drain the baby's lungs after birth, or to intubate. They don't know if this baby's going to be healthy or sick. Yeah.
Right. So they wanted me in the OR so that the NICU team, because they were operating under that this baby was going to be very sick.
Yeah.
And, so they wanted me to deliver in the OR.
Yeah. What was that like? What was that like for you? You had obviously your first pregnancy went, relatively well, and now you're in labor and you're worried that you may have a sick baby. Like, what was that like, just experience-wise, going through labor with the uncertainty of whether your baby's going to be well or not?
I think it was actually more just like, what are we going to like knowing that the baby wasn't going to, like they were taking the baby straight to the NICU, and it was like kind of like, who was going to be there for me? Like my husband needed to go with his baby, and like, so my mom and my mother-in-law actually spent the day sitting downstairs in the hospital waiting for me to have this baby so that they could be there for me. But I didn't want either of them in the delivery room.
Got it.
But I needed at least one of them to be there for me after the baby was born.
So it was more the logistics of it than sort of the existential part of it.
I don't think I think to some degree we were trying not to think about it.
Okay.
I think my mom and my mother-in-law had different, coping mechanisms. My mom's had like everything. God was going to take care of us. God was going to take care. In my mom's head, God was going to take care of us and everything was going to be fine. And my mother-in-law was a little bit more worried about like the sick baby and what the logistics of that were going to look like. And I think we were somewhere like in between. Like we knew this baby was going to go to the NICU. We knew it was going to take some time. We knew there was a possibility that, beyond that, we might be, going home eventually with a sick baby. But like, I don't think we really took so much time to think about that. I think we were more, trying to, like initially we hadn't even know what we were going to have. And like at some point, like, but through all these daily ultrasounds, my husband's like, maybe we should just find out so we can celebrate who this baby is going to be before she's whisked off to the NICU. Yeah. So we found out like early on in my hospital stay, we found out what we were having so that we could celebrate who the mother was going to be before. Because when she was born, like they whisked her off. So like it was. But it was, and I think I think the whole thing was, it was very stressful. I think like I was pushing for a while, and I remember thinking like I just can't do. I mean, actually, even before I started pushing, and then on the operating table, and then I don't remember what happened, but they ended up stopping the contractions again and giving me a little bit more rest time, and then we started pushing again like a half hour later. Okay. And at that point, we were pushing for a while, and I actually think it's interesting because Abigail, one thing was she was sunny side up,
right.
So my doctor had to help rotate her before we could get her out.
Right.
And when I asked the doc this time whether she thought the baby was sunny side up, she's like, I think it's very slight. I don't think it's going to make a difference in the pushing. But and I honestly, with everything, with what I've been through that day and, the past bunch of weeks and knowing this baby was going to the NICU and being stressed about that, I don't think I necessarily advocated for that piece of things, like that maybe we should be rotating the baby. Because I was just more right. Worried about everything else.
That's a particular skill and it's a particular situation, and it's not always the right thing to do. It's hard. I mean, that's not, each circumstance is unique, whether it's the right thing to do or not, and based on the exact position, what's going on with your pushing. So it's hard. I mean, whether you advocate, it's not typically like, hey, can you please rotate the baby? Like, oh yeah, great idea. And it doesn't
would have been more. No, it would have been more of a discussion, but it wasn't even on my mind at that point. And the doctor ended up having to do an episiotomy, which I wonder, had she rotated the baby, might that have
maybe
avoided? But honestly, I don't know. I was happy she cut me when she did, and she said she hadn't done an episiotomy in 3 years, and she's like, and your baby made me do one. But I was just happy that I got my vaginal delivery, and I was grateful for her for that she did the episiotomy when she did, because I remember thinking at the beginning of that set of pushing that I'm like, I'm not sure that I can do this for much longer. Yeah. And thank God she cut me, and baby came out, and she cried right away, which I think we were kind of expecting. We were kind of expecting that wasn't necessarily going to be the case given the fluid on her lungs. And thank God she cried right away. We were all very excited by that.
Yeah. How long did it take until from when she was born that pretty much you realized she's good? I mean, obviously there's always question marks and this and the, but basically, was it 1 minute, 1 hour, 1 day? At what point did you realize this kid's fine?
She was in the NICU for 3.5 weeks, but she came off of CPAP after 24 hours. They took her off CPAP. They actually took it off to clean, and she was doing well, so they kept her off, and I was able to breastfeed her already after 24 hours.
So and quickly.
That was very quick. I was expecting that I was going to be pumping for weeks before I even, got to breastfeed the baby. And by the second day, I put her to breast. Yeah. And that was really great. The doctors kept saying that night, I actually didn't even go see her that night. My husband went to her, and I think his parents, this is a little weird. His mother held the baby before I did, but the doctors kept saying she's doing great, because they were expecting this really sick baby, and here we had this baby who's it was a 36-weeker who needed some breathing support. She needed some antibiotics for her hydronephrosis, but other than that, she seemed to be doing great. And she was 6 pounds at birth, and compared to a lot of the other babies in the NICU, she was substantial.
Yeah, it's one of the bigger kids there. Yeah,
and thank God, she was doing really. I think by the end of by the second or third day, we thought there was a possibility she would be home before Shabbos. Ultimately, that didn't happen, and I think that was very hard for us, because we kept getting our hopes up and then down again. I think my husband had the most. My goal was this was right. She was born November 20th. So my goal was to have her home for Hanukkah, which was I think the second week in December. And my husband's goal was to have her home before her by around her due date. And I was originally due December 17th, and she came home on December 13th. So I think his goal was the most realistic, just in terms of how we handled that,
Look, so, you're 6-7 months out now. You have this beautiful baby you're holding, right? So looking back on all this, what's your takeaway? What do you want our listeners to know about this?
I think number one, I really learned a lot about, being in the hospital, the medical community, and what it's like to, be inpatient in the hospital for 5 weeks. That was an experience, and really how important friends and family rallying for you, whether it's, offering to bring food, whether honestly, it was the visitors in the middle of the day, the people from my family and community who just, would take a day off or had, time in the middle of the day, who just came to visit and spend time with me, because it's extremely boring to be in the hospital for long periods of time, especially in a situation like this where I was fine. I was 9 months pregnant, so uncomfortable, but But I was fine, and I was there because this is what the best thing that my baby needed, and I really think one of the biggest takeaways is what you can do for people in similar situations. If you know somebody's in the hospital, offering to visit. And honestly, even the people who didn't come but made an offer, I have some time today, can I come? Just knowing that people really were out there thinking for us and, rallying behind us. My family had a chat around the clock. People were saying Tehillim Psalms for the baby, and thank God. I really think those helped make the situation, what it was better. And I think really, also my biggest takeaway is really just, how much medical things the average person is unaware of, and how much you really can learn throughout a process like this. And that, just being aware of the basics, what things are looking for, and, and what can and can't go wrong, just to be aware, so that when things happen that, you're not caught in the unawares of, I've never heard of this before. What does this even mean? and Googling, which Google can be scary, or your podcast, which is a little more helpful in, providing.
Yeah. Google. Yeah. Google's not good if the word Hydrops is coming up. I can say that right now. Google's a bad place to be with that. It's going to sound very, very bad. Wow. What an amazing, really crazy story.
Yeah.
And thank God it ended so well, and she's doing great, and it's great. And I really do appreciate those lessons we spoke about at the front end of the podcast, but also, that you reiterated at the end how, important these things are. And I appreciate you volunteering your story and for coming on and taking the time. I'm sure my listeners will really appreciate it as well. Thank you so much.
Thank you for having me.
Thank you for listening to the Healthful Woman Podcast. To learn more about our podcast, please visit our website at www.healthfulwoman.com. That's HEALTHFULWOMAN.com. If you have any questions about this podcast or any other topic you would like us to address, please feel free to email us at hw@healthfulwoman.com. Have a great day. The information discussed in Healthful Woman is intended for educational uses only and does not replace medical care from your physician. Healthful Woman is meant to expand your knowledge of women's health and does not replace ongoing care from your regular physician or gynecologist. We encourage you to speak with your doctor about specific diagnoses and treatment options for an effective treatment plan.